something in the interim that would make him more comfortable with the appearance of his teeth. But Lumineers was thrown out. It's that's a trade name for a type of veneer. That's something you definitely wouldn't want to do on a 10-year-old.
Right.
I think your son is not old enough to have a permanent restoration like that place. But there's numerous ways to affect the cosmetics of his smile by using resins and bonding agents and make the smile look great without going to the Lumineer stage or any type of veneer or ceramic restoration at that age. And just from a sedation standpoint, I wouldn't sedate a 10-year-old.
Well, I mean, when he goes to the dentist, he is sedated somewhat already because he doesn't know he gets shots.
Right. A lot of pediatric dentists will give kids a little concoction to drink.
It's juice.
Right.
Yes.
Right. And that kind of knocks them out enough to where they can work on them. And that's what I would recommend in this scenario.
What age do you feel like would be significant for him? Because his teeth, as he gets older, something serious is going to have to be done because he gets picked on about the color of his teeth. And, I mean, they've said that as at this point, they can't come no whiter. They bleach them. It doesn't do any good.
Patty, that's a great question, and I'm sure that he's self-conscious of this, and he's at that age where he's reaching puberty. So would it be during his adult years, and what would be the appropriate time where major work would need to be done, and if he's apprehensive, that sedation would be appropriate?
Right.
Well, I typically in my office, it's not something that I would do on anyone under the age of 18. So
18.
I think for your son, I would wait until he's 18 before he's sedated the way we sedate.
Right.
As far as procedures that can help him, there's a whole number of things. He could be put on some nitrous oxide and have some bonding done with just resins, and a bonded resin restoration could totally change the appearance of his teeth without going again to that veneer stage. That's a big deal, and I wouldn't recommend that.
Patty, there are options for you, and we thank you for calling.
Okay, thank you so much.
Yes, and good luck to you and your son.
Thank you.
Thanks for calling in from Statesville.
Thank you.
Going back to the sedation medication, is it going to, you did address that it's going to make me groggy afterwards, but how about, is it going to make me nauseous?
No, that's a great question. Nitrous oxide can make you nauseous.
What is that?
The laughing gas that everybody talks about. Nitrous oxide can make you nauseous, and if you get nauseous from this procedure, it's because we put you, if you do, it's because we probably put you on nitrous oxide too, and we do that sometimes. But not everybody gets sick with nitrous oxide. In fact, a very small number of people do. We've never had a patient get sick from the pill. The pill, exactly.
Interesting.
It doesn't make you sick to your stomach. It will make you feel loopy. That's what it's designed to do.
And will this drug interact with other medications that the patient may be on?
It can. And
that's why you go through the history.
Exactly, exactly. There's certain medications that patients take. There's some antibiotics out there, erythromycin, that we definitely would switch them and not sedate them while they're on that medication. I spoke about some drugs like narcotics. Those are patients that we do not sedate because they're already under a CNS depressant state with a narcotic on board. So this drug drops their respiration down, and we don't want to have a synergistic effect between some type of narcotic, say cocaine or something, and this. So that's a big no-no. So we don't sedate patients that are on drugs. We don't sedate patients that drink alcohol. You can't have an alcoholic drink 24 hours prior to this procedure.
For those that are under pain management and they're under prescribed narcotics, could they have a procedure done with the sedation?
They can, and we do. Those are again, those patients are the ones that I have a close relationship with their medical doctor on, and we do speak with them, let them know what we're doing, and have that conversation long before the procedure's ever started.
Dr. Ed Porter, your time's gone. What's your closing message here?
Well, I think the main thing that patients need to understand today is that there's options for those that are fearful, for those that have just been reluctant to go to the dentist for whatever reason. There is a pill that they can take that can help them get through that procedure, get the dental care they need, and hopefully that 20 to 30% of the patients out there that don't get dental care can get it.
Well, we thank you so much for
Thank
being
you.
with us, and we thank you, as always, for tuning in. Dr. Ed Porter of Cosmetic and Restorative Dentistry right here in Charlotte. He's located in the Arboretum area. Now, if you did not get your question in during the hour, you can either email me during the week or call the station, and we'll get the question to Dr. Porter and his staff, and he'll respond. As always, we hope that this medical broadcast has helped you become more health-wise. Once again, my email address is jpop@wtvi.org. And as all season, we thank you for being part of this mission. You know that WTVI is an essential resource in connecting people across the heart of the Carolinas. We hear it from you week in and week out. We thank you for being here, and we look forward to seeing you next week. Make it a great one.
If you would like support group information about tonight's topic or any Healthwise topic, call SupportWorks at 704-331-9500. If you have a comment or question about Healthwise, call 704-371-8836 or email us at healthwise@wtvi.org or go to the website WTVI.org. If you are interested in being a guest on Healthwise or like to sponsor a Healthwise program, please call Suzanne Milkey at 704-372-2442. Learn more about Healthwise and other local productions at WTVI.org. Go to our website and you will see current and upcoming events on air and in the community. That and much more at WTVI.org.